The HSE are asking some of the passengers who travelled on Etihad Airways flight EY45 from Abu Dhabi to Dublin on Saturday to contact HSE Live. This is because a confirmed case of measles travelled on this flight. So, are we back to the days of contact tracing? Joining me now to tell us all is Eoghan Corry, owner and editor of Travel Extra. Good morning, Eoghan.
Good morning, Anton.
So this is COVID contact tracing getting the dust blown off it, is it?
Pretty much. I mean, a lot of the systems that we used during COVID are still there. They're still ready to be pulled into action. I think they evolved a little bit slower than most people would have wanted during COVID. But it's really, regardless of the pandemic, the nature of the information that's available to in a case like this, the airline will know exactly where the passenger was seating. They'll know exactly who was around them. So for the aviation leg of the journey, not so much the post-aviation leg of the journey, a lot of information is already there. The call out this morning is that if you have any symptoms and if you have been on that flight, to contact your GP, contact them remotely because you could be infectious. Don't arrive in the waiting room. And the HSE website is burgeoning with lots of great advice on that.
Now, Eoghan, there was a simple clarity around COVID, particularly in the early stages, where you knew that if there was contact tracing done, you were told that's it, stay at home and go get either an antigen or a PCR test. Is there the same clarity with measles? Are we expecting that everybody who was on that flight will now isolate themselves?
No, not at all. The major difference, COVID we were in very uncertain territory and it was outrageously infectious. It just seemed to be so infectious that what the pictures and the information we got from Italy in the very early stages scared every government in Europe effectively and caused a lot of the systems of information sharing to break down. This is very different. You're talking about immunocompromised, pregnant, children under the age of 12. A lot of people born before 1978 will have had measles. I remember my mammy putting me to bed and making the measles go away myself. So it's really a case of if you've any suspicion at all that you may have been in contact or maybe a carrier, that's when you contact the GP. It's less frenetic, but it's still dangerous. Listeners will remember the outbreak in 1999-2000, where 3 young lives were lost in North Dublin, which was the last time we had, I think, a major measles situation in the country.
And of course, we had that death of that man in his 40s recently returning from the
Shocking.
UK, having been infected there. During the COVID epidemic, obviously, one of the things that happened was the bounds of sort of some of civil liberties legislation got tested because there was an immediate and urgent crisis to be dealt with. What about in a context like this where it isn't such a significant public, not to say that it isn't a public health problem, but it isn't of the scale of COVID? Will airlines be reluctant to share private information? Are they constrained in what they can share?
Not at all, because you got to remember, and this is important in the COVID debate, Anton, airlines all have a huge responsibility towards their own staff. They're not in the business of endangering cabin crew pilots. So if there is an Ebola situation, which happened prior to the COVID pandemic, and there will, as others arise, aviation will their risk is what they do. They quantify the risk, but they're never going to tell their own staff, I'm putting your life in danger just to fly to a particular place. The same comes with information sharing. During the pandemic, the airlines were very ready to share any information to help the contact tracing. There are some civil liberties issues or information sharing issues. It doesn't just apply to health issues, it applies to other legal situations. And we have had governments that have used passenger inventories for malevolent reasons. We saw what happened with Belarusian and the Ryanair flight. But the aviation industry's relationship with government and with the legal system in every country they fly to is cooperative, and they generally try to work if something as clear cut as health prevention, there would be not any hesitation there. There is some sort of hesitation in geopolitical situations like we have raging in 3 or 4 parts of the world at the moment.
You mentioned the sort of the lessons that had been learned through COVID. During COVID, one of the big debates was about aviation and to what extent being on an airplane would increase transmissibility Or there was even an argument that suggested that it could possibly decrease transmissibility because of HEPA filters, and that meant that the air was cleaner in an aircraft than outside. Where do we now stand on that? Are you at more risk of catching measles if you've shared a flight with somebody, or less?
Generally, the aviation environment, because of the HEPA filters, is fairly clear-cut. There isn't a high risk of infection. Measles and COVID were very high-profile examples of this, but you are dealing with, in some cases, over 300 passengers on some of these Middle Eastern flights that will be carrying colds, common colds, flu, and they could be sitting beside an immunocompromised person anywhere at any stage. The advice from aviation is, if you have anything transmissible, do not fly. That could actually it could actually cancel travel insurance in some cases. We're not at the extreme position as we were during COVID, where you had to sign a declaration before you boarded the flight that you weren't a carrier. But it's still there. The aviation environment is pretty, by comparison with things like the bus to the car park, it's fairly much, it's a less dangerous situation, for want of a better word.
Although, is it a fair assumption that it makes a difference, or does it, depending on whether you're short haul or long haul? I mean, in this instance, this is in from Abu Dhabi, which I assume means, 5-6 hours?
It's 8 hours, and the Abu Dhabi flights would be a little bit different from the other two carriers, Emirates and Qatar, in that they have a very high, they serve a different range of connecting destinations. They're pretty much the leaders in, for instance, the Indian market, for the number of Indian cities that they cover. So different airlines will have different risk factors. There's, if you're serving Africa, you're dealing with different sort of risk conditions. They spray down aircraft for mosquitoes. The listeners would have seen them walking through the cabin with the spray. All of those sort of things are vary from country to country. But aviation is in the safety business. They're in the business of protecting their passengers. And during COVID, there was a little bit of a sort of a pile on aviation, saying that when everybody was frightened, let's close aviation. But aviation is not in the business of, as I say, endangering their own crew, their own pilots. And it turned out during COVID that the aviation cases, the infections from COVID, were a very, very tiny percentage of the overall, less than 1%.
Lastly, Eoghan, as a man who travels a lot, what are you seeing in respect of mask wearing? Is anybody still doing it?
The Asians still doing it in large numbers. It's quite a rarity to see someone on a European Ryanair flight wearing a mask. You'll see 2 or 3 of them. They're still there. Masks are still there. But one of the things that happened in the last month, Anton, is the last of the restrictions in some parts of the world which still had COVID restrictions, the last of them have been removed. For the first time, we're back to pre-pandemic levels of restrictions. We're not back at pre-pandemic levels of travel yet, because there are a lot of people that are still a little bit jumpy about jumping on that aircraft.
Eoghan, thank you very much for your time. Texas say, coming home from Rome, a lot of elderly people wearing masks. If you want to get in touch, 53106 at a cost of 30 cents, or of course you can get us on WhatsApp, 087 1400 106. That was Eoghan Corry, owner and editor of Travel Extra. And the flight in question was Etihad Airways flight EY45 from Abu Dhabi to Dublin. It was a Saturday flight, and the HSE is looking for some of the passengers on board to contact HSE Live. And of course, any information that you would want in respect of measles, relative transmissibility, if you have been on a flight, whether or not you need to contact anybody, and all of the various different recommendations in respect of the vaccines and the age cohorts who are now recommended to get vaccines, or who we are being told, if you're of a certain age, there was significant infection in the community anyway, which probably means counterintuitively you don't need to be vaccinated. But any of that is available on hse.ie.